Hey guys, Coach Seiji here. I'm 1 week and 1 day out of surgery. I haven't made any videotapes for quite a while. So the last time I think I was like complaining about the first nerve block wearing off, which was the one that fed the back of my leg. And so that pain was from the arthroscopic tools. That is not pain. Just ignore what I was saying. A couple days ago on Thursday, the drip that was providing the nerve block to the front of my knee wore off. And then that's the pain that people warn you about. So I had a patellar bone, tendon bone graft, which means they cut a chunk of my patella out and a chunk of my tibia with the patellar tendon intact in between. I don't really feel anything on my tibia, but the patellar piece, I can't even verbally describe how bad that hurts when I go vertical and my leg goes low. I'm just guessing the rush of blood going down into my leg and the increased pressure down there is what starts the pain. It is unreal, and you don't recognize it or you don't think it's coming until the first time you get up. First time it happened to me, I had to get up and pee, and I mean, by the time I got back to my bed, I was incapacitated. It hurt so bad, and then all I could do, I couldn't even make a noise out of my mouth. I just had to lay there. My wife didn't know exactly what was up for a couple of minutes until I could, have her help me get some pillows under my leg and get it as high as I could get it. And then about 20 minutes later, the pain went away. Today is Tuesday, so it's 4 days since the block wore off, and things are a lot better. I still get the pain when I stand up, but it takes longer for it to start, and it goes away a lot quicker. In between, the intensity of the pain is identical, but the duration, the start is later and it ends sooner, so that's improvement. A couple things, and I want to warn you about that. Like, don't get all happy like I did that you woohoo survived that first nerve block wearing on. That's nothing. It's the second one, and it's, I don't mean, there's not a number to describe that pain. It's unreal. It's like somebody is inside your kneecap, right where they chunked the bone out, and just like happily, firing away with an arc welder or a blowtorch or something. So just warning you about that. It's coming. So I'm on my fourth or fifth day, and like I said, slow improvements. Another thing I want to warn you about is, dude, I'm all about independence. Like, I didn't want my wife to have to help me pee, but she does, and so I had to get over it. I'm just telling you, man, get a friend, get a family member, get somebody to help you for the first week, because when that second nerve block wears off, you will not stand up. Like, you will do everything possible to avoid that pain. It got to the point where I was so consciously not drinking ever to just get dehydrated so I wouldn't have to even rock forward to increase the pressure in my leg to pee in a bottle. That's how far you'll go to dodge that. I'm a lot smarter now that I've been dehydrated and felt what that's like with all this medicine in you. But yeah, just get somebody to help you. Just shelve that ego. And I mean, it's been better for my family that I have been dependent on them. It's something that I've never done, and I feel a lot closer to my family because they are basically doing everything for me. My wife Shay and my daughter Sequoia. Another bit of warning: that first physical therapy session, you're going to feel heroic. But remember, the drip's still going, or however many you get with a drip in. As soon as that drip wears off, I mean, you get punted back to day zero. It's like a start over. It was a little depressing. Another thing I want to warn you about is you're going to start getting all anxious to make improvements. And I mean, I've been calling on my pro athlete friends that have been through this, and some people I'm quote unquote ahead on therapy, and some people I'm not near what they did. Some people, dude, I was walking in a week. It's so variable, and just don't get all wrapped up and competitive and trying to get to these benchmarks before anybody. It's just not worth it, and it's kind of unproductive. And I'm going to admit I got caught up in that. Like, I was going to walk in a week and go back to work, and it was ridiculous. I'm not going back to work next week. There's no way. So that, and one more piece of advice: I am reclined in a electric recliner chair, like a lazy boy. My wife had the bright idea of renting one, so we rented one for $100 for the month, and it's been a total game changer. Like, I was laying in bed, and 4 hours later, my back would feel sore, and I'd have to wiggle around and try to get comfortable, and I just couldn't ever really get that comfortable. And so now I'm posted up in the living room. I just got a TV the day before surgery, so I can watch TV somewhat sitting up. I can eat somewhat sitting up. Whenever my fixed position gets a little uncomfortable, I can just change it. So that's another piece of advice. I would look into renting one of these babies before your surgery. I mean, I would never buy one of these things, but it's been my best buddy almost since we've got it. So that's it for now. I feel like I'm turning the corner because the duration of the pain is reduced. I'm making more gains and flexion, so I'll have to check in with you soon. And it feels great to be headed the other direction, the good way. All right, thanks, guys. See ya. Hey, guys. Coach Seiji here. Pretty much spent the most of the day back at the surgeon's office. Learned a big lesson. So for some reason yesterday, that anterior knee pain when my leg goes down it got a little worse instead of a little better. I was feeling it pretty much no matter what position my leg was in, and for the first time, it was kind of always there instead of fading in and out. Sort of wrote it off to too many days of physical therapy in a row. Had to chill out, hardly do any therapy, and then I woke up at 1 a.m. In a puddle of blood. It was super scary. I didn't feel the bleeding. I just felt warmth on my leg underneath all the wrapping and cooling stuff. And sure enough, it was a lot of blood. I texted the surgeon, not realizing what time it was, and incredibly, he immediately texted me back at 1 a.m. and basically told me to come in the morning, regardless of the time, and he would just drop what he was doing and take a look. He didn't sound super alarmed, but he didn't want to take it lightly either. So got no sleep, had to keep looking at it, had to keep kind of changing the dressing. It never really stopped bleeding. And so what happened was I popped a stitch, he thinks very early last week, probably right away while I was doing therapy. Since he had closed it up really well with tape, and then my skin had kind of immediately started closing itself. The blood from the stitch area, the lower layers of skin, couldn't bleed out, and so it's been kind of trickling into the areas nearby, and that's the pain I felt, was the increasing pressure of that blood just building up in the spaces that it could find, and finally ran out of space. And it pushed through my skin in what looked like at first a pin-headed blood blister that grew into the size of a sandwich, this huge, crazy, giant blood blister on my knee, which then finally burst at 1 o'clock. So good news is it actually wasn't anything serious, and as soon as I could tell in the morning, that it felt better, and then as soon as the doctor drained an amazing amount of blood, 90% of the pain I was feeling has disappeared. So that's the good news. The bad news is I cannot bend my knee for a week to allow all those skin wounds to heal. So no physical therapy beyond isometric contractions. I'm basically losing a lot of therapy for a week. So that's a little bit of a bummer. And here's the lesson I learned, guys, and I'm sure a lot of you will be in the same boat. When a physical therapist says, go to the point of slight discomfort, that's what he means, slight discomfort, which, is not like the pain I feel when I push myself doing sports. That's not slight discomfort, that's freaking discomfort. When they say slight discomfort, they mean to our level, irritated, or I don't know. You just got to back down somebody's verbal description of how much pain you should be in, because you might be foolish like me and think that you're some kind of superhero, some kind of 49-year-old superhuman with the freaking, healing ability of a newborn baby. I don't know. It was dumb. Like, I know exactly when I did it. It was the first day of physical therapy, and the therapist said, "Hey, voluntarily flex your knee to the point of slight discomfort," and I freaking gave it my all, you know. And it didn't move much, but I'm sure that's when it popped. So, little words of wisdom. I'm definitely better now, and we'll talk soon. All right, bye. Hey guys, Coach Seiji here. Obviously not at home anymore. Unfortunately, back in a hospital. Last time I talked to you, we had corrected some bleeding. Had thought that we identified the offending stitch that popped, and then the blood filled those spaces, and etc., which is correct. But it continued to bleed with no signs of slowing. So my doctor, being a caring physician and not giving a crap about what day it was, called me on a Saturday and told me that I needed to show up Sunday for surgery to open the thing up and look around and see what the heck was going on instead of waiting around for Monday. So he scrambled and got me in the next morning. So on Sunday morning, he opened up the knee. The original plan was a 20-minute clean out and to look around and see where the blood was still leaking from. We drew some fluid out of the knee and it was negative for infection. So we did have a negative test. So, at that point, we didn't know what was up because there was no infection. So we opened it up, opened my joint capsule, and obviously it was infected. In his words, as gentle as he could tell me, because dude, it hurt. I keep saying it like, oh, this is the worst pain. But this time, I'm telling you, I'm not going to say it again. The pain I felt after this procedure was the worst pain. He had to take a tool, like a hoe, and scrape out of the inside of my knee joint the pussy, gnarly looking gel, anything that looked like an infected piece of tissue that had been sitting in fluid. He had to scrape it out of my joint capsule, flush it, suction it out, and keep scraping it until he saw nothing. So he had to do this both on the inside of my joint capsule and the outside of my joint capsule, and stitch me back up. And I was told when I woke up in the recovery room that apparently I blow through pain medicine, and I emptied every fentanyl vial they had in storage at the hospital. And I was on the maximum dose of fentanyl and Dilaudid post-surgery for a while, and I was hitting that maximum and they were going to run out. So luckily we got the pain under control. I got wheeled to a room, and of course we still didn't know the offending bacteria, but it was thought at the time that it was a staph infection. Nobody knows how it got inside my knee joint. I mean, the doctor's been awfully open with me, and he eventually said, "Hey, look, man, I'm the dude that cut your knee open, so this is all my fault." Even though I don't really look at it that way, I mean, he did everything technically correct, but we didn't know where the staph, how it had ever gotten in my knee. So before he stitched me up, he mixed a bunch of this antibiotic paste and painted every surface inside of my joint capsule, and then painted everything around my joint capsule, and then put me back together. And instead of worrying about the cosmetics of the suture line, he just stitched it like a quote unquote baseball stitch, so I couldn't pop it. And I was warned that the scraping would be one of the most painful things. And like I said, I get it. I've said it, that this pain is the worst pain, but I'm telling you to just ignore that again. And the pain I felt after the second scraping procedure was the worst pain that I've felt. So that happened on Sunday. Today is Thursday. The day before yesterday, we found out, luckily, that the bacteria was staph, which is a bad thing to hear, but it was it was a sensitive staph to antibiotics. So it's not MRSA, it's SSRA, and antibiotics do work. So we had antibiotics going through my system because the first time I popped the stitch orally, and then we had antibiotics running into my leg, using that paste during the procedure, and now I'm on a antibiotic drip that was chosen on the profile of the sensitive staph that I did end up with my knee. So it was targeted antibiotics. Today is Thursday, so I've been in the hospital since Sunday. This is the longest I've been in the hospital, and by far, since the beginning of all of this, the longest I've ever stayed still. It's the longest I was told to stay still. It's the longest where I haven't stood up. So today I have my first physical therapy after being vertical or horizontal for almost 3 weeks, and I consider myself a really fit person. And the physical therapist put me on a walker, and I made 6 steps in a little circle at the foot of the bed, and I had to go back to bed. So everything about me has become weaker because I haven't been in gravity for 3 weeks. It was pretty eye-opening and a little degrading. Like I couldn't hold myself up with my arms on the walker, even though they're not affected by the injury. Both of my legs have significantly shrunk. Of course, the good side is not as bad as the bad side, but they're both much smaller. I imagine I've lost weight down there. Even my arms are weaker, so it's a real ass kicker. I got a long way to go. I'm trying to get out of the hospital. For me to get out of the hospital, I have to wean myself off of the IV Dilaudid. I'm getting a 2-gram dose every 4 hours, and then every 4 hours I'm getting a 10 milligram dose of Oxy, and every 12 I'm getting a 20 milligram dose of Oxy, and then every 12 I'm getting 2 grams of Dilaudid. So today I start weaning myself off. I'm on a lot of narcotics because the pain from the scraping ordeal was, I don't even want to imagine it again. So that's where we're at. Wish me luck on setting some markers to get out of the hospital. Number 1 would be get the pain under control to avoid the IV Dilaudid push. Number 2 would be to be able to get myself up out of bed onto a walker, and I don't know what the predetermined distance is, but at least able to hobble down the road. Then I don't even get to go home. I got to go to a residential treatment facility for about 5 days before they'll let me go home, because I cannot take a fall at all, is what I've been told. Like, I imagine some of it is I can't break my skin, but they also don't want to redo my graft, which has already been, attacked by bacteria. Fortunately, on his scope, the graft looked okay. So that's where we're at. It's been quite the ordeal. I never would have guessed that this would have happened to me. I know there's some good somewhere to come out of this. One thing already is in my past, I haven't been at all empathetic enough to people with physical disabilities. And nurses, man, like, nurses have a hard job. And a lot of how I get out of this or overcome this injury has to do with the nurses. They are waking me up either every 2 hours or every other hour and making sure I get the medicine in me. They've seen it all. They've seen me cry, they've seen me get mad, and they stay professional. So if you're a nurse, man, high five to you. If you're married or if you're married or your other half is a nurse, couldn't thank you guys enough. Okay, that's enough of my babble. I'm about an hour away from trying to push out the need for IV Dilaudid, so probably need to chill out for a while. But thanks, and hopefully you'll see me standing up soon. All right, bye.